mentioned before that my name is Stuart Schlossman. I'm president and founder of MS Views and News. We want to thank Celgene and Sanofi Genzyme, all right? We cannot do our programs without the support of the pharmaceutical industry. And so I thank them, and I do hope that you can all thank them as well. All right? Mary Hughes, MD, attended the University of Tennessee, Memphis Medical School and did her internship and residency in neurology at Emory University in Atlanta, Georgia. While completing her fellowship in, big word, electrophysiology at the Medical College of Georgia, her career focus was forever changed with the diagnosis of multiple sclerosis in her younger sister. For the past 25 years, she has been involved with caring for people with MS. She served on the board of directors for the National Multiple Sclerosis Society and remains involved on a number of committees. She has participated in clinical trials for investigational drugs for multiple sclerosis. She has been an active educator, targeting audiences ranging from medical students to healthcare providers to people living with MS. Currently, she practices in Greer, South Carolina at Premier Neurology. Let's welcome Dr. Hughes. Thank you for doing this. And then we have Jill. Jill Molberger has been an MS patient for a number of years, and Jill volunteered to do this. She has never done speaking in front of an audience before or in front of cameras. So we'll get to see how stage fright, how much she has. Okay? But let's begin. Thank you. That's your turn.
That's our turn. So, as Stuart handed this to us, so we're actually, I would just say this has been really an exciting year. And, okay, thank you. In caring for people with multiple sclerosis and looking at the wide range of treatment options. And so, what are you shaking your head for? You're going to need a mic. Is that what the conversation? I can hand it to her, though. We hand it. And so, what we really want to do, and I think I've been a big fan of Stuart's for a number of years now, and really, it's really about what you want to talk about, what y'all want to talk about. It's a little bit of the hot seat for the neurologist because you better be prepared. And I think what he's done with MS News and Reviews has just been incredible, and we're so happy to have you here in Greenville.
Thank you.
And so, Jill, what do you want to start it out with?
Dr. Hughes, can we talk about MS progression, please?
Okay. So this has been, we used to not like to talk about progression, right? It was kind of the dirty word. It was what people worried about. We know that when people are first diagnosed, the course tends to be more what we call relapsing, where so something happens and then there's some degree of improvement. In the untreated state, and that's a very important point, but in the untreated state, after people have lived with MS about 15 years, that story changes. And people start to talk about, you know, I'm just not walking as well as I used to, or my hand dexterity is not as good. It's not like in September, I remember when my right arm went weak. And we didn't talk about it a lot because we didn't have a lot of options. And that has really changed in the last couple of years.
What can the patient do to slow the progression of the disease?
So I think, unfortunately, I hate to say this out loud, but it's wellness. It starts, all right? I can tell who exercises and who does not. And there are times I fall off the wagon and I'm not exercising either. But we talk about that a lot. And so the better you take care of the machine, the better the machine's going to take care of you. So if you smoke, make sure you quit. Eating healthy. Some of us are healthier than others, but trying to really focus on that. And then periodically we all need to be thinking about, you know, have we been to physical therapy recently? Are there changes that we need to address? And then, oh yes, there's pharmaceuticals.
Well, what are the medications that might slow progression?
So in 2019, there was not one but two drugs that got FDA approved for secondary progressive MS. Not only did two drugs get approved, they got approved in the same week. So it really is pretty fabulous. And these drugs were both studied in looking at, can we slow the progression and how people are progressing over time? So when we're talking, and actually a really interesting point is, how do you know if you're progressing and how do you have that conversation? So I tend to ask things like, how's work going? You know, a lot of times when people are progressing, maybe they just don't want to hang out at the mall like they used to. So the rest of the family, go ahead, because I may be slowing you down. I walk a little slower than I used to. And so sometimes we kind of see these people pulling back from activities they've been involved with. And in trials, it's pretty easy because we say, all right, we want you to walk from point A to point B, and we know how long you take to walk. We can look at your MRI. I have to hang this. It feels like I'm eating it. And look at your MRI sometimes, but unfortunately with progressive MS, the MRI a lot of times is quiet. So it's that frustration of, you just told me my MRI is not changing, but I know I am. All right. Have you noticed things along the way?
I noticed some things, yeah, that I don't do as well as I did 5 years ago. I don't see changes on a daily basis, but I'm wondering if other people notice things about their progression. Anybody?
This is time for the audience to respond. You were given a question.
Your balance has gotten poorer?
Yes.
Yes,
I have
sir.
a question about what y'all were talking about. What do you consider healthy eating?
That's a tough topic. So I think there are guidelines that are appropriate for everybody, right? And so I realized a few years ago that I was not the best example. So I looked in my refrigerator and I had all the food groups represented. We had hamburgers, we had Chinese food, we had pizza, and I forgot Italian, something else was the four. That is not eating healthy, all right? We certainly know that we need to eat less processed foods. I think there's agreement that most of us need to eat less meat and more vegetables. The American diet tends to have too many calories, all right? Now, there are a number of diets that have advocated for people living with MS. And have you tried any of those diets, Jill?
No, I have not.
I've tried one of each. And they range from the, if it tastes good, spit it out, to more of the Mediterranean diet, which kind of encourages some red wine, some hummus, you know. So there's a range. But I think the important things is really looking at, you know, processed food. If you're eating food from a box, look to see how many ingredients are there. And if it goes all the way down the side, maybe you want to rethink that, all right?
They also say walk around the outside of the grocery store rather than up and down all the aisles.
That's exactly right. So the vegetables tend to be on the outside. The dairy tends to be on the outside. You know, the really good stuff like cereals and cookies, that's usually aisle 7. I just told you I'm not the one to teach nutrition. And I know there's a couple people in here who are like, oh, she should not be teaching nutrition. But are there people in the audience, ignoring one person in the back, who've tried any diets along the way? And do you think you've been able to notice a difference?
I'm eating super low fat, which means high sugar, which is kind of backwards from most people.
I need you to wait for the microphone.
It seems to work for me. Are you ready for the microphones? I love mics. Okay. I've actually got a last name for my mic. It's Yeti.
Oh, okay.
Michael Yeti. Have you ever heard of him?
No.
Okay. Well, I eat low fat, really low fat, which means high sugar. And I don't know. It seems to make me feel a little lighter on my feet. And the sugar's probably helping to keep my energy up. But I don't know that this is a good or bad thing because I've never seen a nutritionist.
Yeah. So most of it, that's actually an interesting question. I actually grew up with a dietitian called my mom. Of course, I ignored everything she trained us. And then later we go like, we were ahead of the curve. I was in college before I knew food came in a box. And I remember calling mom and said, you're not going to believe this, but you can get like pasta in a box and all you have to do is, add hot water. And she was like, you don't know how spoiled you were. Now I'm very familiar with food that comes in boxes. High fat, I think we instinctively would say that's not a great option, right? Looking at what type of sugars, added sugars to your food. When we talk about taking care of the machine, we also have to make sure we're taking care of our hearts. We need to be taking care of our risk for diabetes. So that's part of what gets incorporated. Woman in the back I've never met before, but she needs a more understanding employer, I hear.
Hi, I'm the ringer. Yes. I follow the WALS protocol for MS. I'm not here to advocate specifically for that for any of you, but I think it speaks to moderation of processed foods. It's very low sugar, so it's a little bit different from that. I've had really great results with it in terms of energy and just kind of my husband has noticed a difference as well. But I think the idea behind it is to find the things that trigger the inflammatory response in you, and it's different things for different people. It's just a journey that you go on. So
thank you for that. But if you're trying to tell me to eat your meal, it's not going to happen. I'm a vegetarian.
you can be a healthy vegetarian. This is true.
Dr. Hughes, that was going to be my next question. Are there certain foods that are more inflammatory than others?
I think to a certain extent. So I always kind of separate what I see in the social media and what I see that's been really proven in research, double-blind, placebo-controlled trials. And so, I think the higher processed foods, we certainly would say would be anti-inflammatory. We want to be careful about adding a lot of sugar to our food. We want to watch our high-fat diets. And then when you get into the granules about whether or not you should be eating eggplant versus mushrooms, I'm not 100% sure that's been proven as well. I'm not really as concerned about whether I eat eggplant or mushrooms. I'm more concerned about what do I do with it. So if I bread my eggplant, deep fry it, then that's probably not the healthiest approach to it. If I saute it lightly with some, well, you can tell I listen to people. Actually, my husband does all the cooking, so I must have seen this on a cooking show on TV. But if I saute it lightly with olive oil, that might be a better way of eating that food. So I think part of it is like really paying attention to how we prepare the food is also very important.
So you don't find that red meat may be more inflammatory, or dairy?
So certainly I think red meat needs to be limited in most people's diet. And then when you start talking about avoiding some of the hormones that can go in the dairy is kind of an individual. We certainly the reason why I kind of walk the line on that is because we know that people with MS are a little higher risk for falls, and one of the consequences of falls is fractures. And so do we want to focus on what can we do to help ensure bone health, right? And dairy can be a very important part of that. I think there are some of us who may be more sensitive to dairy than others. I don't know that that's a sweeping statement for everyone.
I have a question over here before you continue.
So I might be saying this incorrectly, but is there the MS chromosome and celiacs, there's some type of relationship with that, and so is there something with gluten, and is that something that you should be avoiding considering that relationship?
So the conversation between gluten sensitivity and inflammation is kind of still controversial in some. I think there are certainly people who have celiac disease, and if you have celiac disease, you need to avoid gluten. There's no question about that. Then the next question is, are certain people gluten sensitive? All right. And that, I think, is an individual decision. If you eat gluten, which we tend to find in all the good things in life, bread, cookies, and you don't feel as well, and you find that limiting that or pulling that out of your diet makes you feel better, then I think that's a very important point. And there have been some studies that suggest that if you do not have celiac disease and you remove gluten from your diet, that for you that may be more an inflammatory response. So I think that there's evidence on both sides of that conversation. I think one of the approaches I certainly support is called the elimination diet. All right. And so, for example, if you're not sure if you feel better eating dairy or not, well, then what you do is you pull dairy out of your diet and see if you feel better. And then maybe down the road you try to add it back in. And if you notice when you add it back in you don't feel as well, then maybe you want to try to avoid that or at least limit that in your diet. All right. I wish there was one diet for everybody in this room. And the reality is there's not. All right. But how do we strategically individualize our diet? How, that's one of the conversations I think is very important, particularly when we're talking about it from a wellness standpoint.
Okay, can we talk about understanding MS symptoms, both physical and cognitive, please?
So I think one of the things that we have traditionally thought about with MS is the physical. And certainly that's one of the challenges with living with MS is that if you do have change in your ability to gait, I can see that across the room. The National MS Society had a brochure, still has a brochure. I don't think I've ever read it, but the title is fabulous. And it's called But You Look So Good. And it really speaks to all those invisible symptoms that we really can't see. I can't see that you're tired. right? I can't see if you're having a little bit more trouble with attention or concentration. I really, unless you leave me evidence, I can't see if you have bladder urgency, right? All those things can have such an important impact on your quality of life, and are very common symptoms with MS that I think we're trying to, even in our office, we recently tried to start screening people's cognition in a way that we can kind of get a baseline of what's people's attention and concentration. Because how do we follow that in other ways? You know, when we're doing the traditional neuro exam, we get a good sense of how strong you are. But as you know, there's so much more to life than how strong your legs are or how strong your arms are.
How would you measure cognition?
So 70% of people with MS will have some changes in their cognition. Now, less than 4% of people will become what we call demented, all right? So I think that's a very important distinction, because we see a lot of information about Alzheimer's and dementias, and people, when they hear cognition, they start worrying about that. But the reality is that's very uncommon. But the more typical findings are, people will say it's kind of the tip of the tongue. Right? So I know a lot of people in this room, and if you ask me some names, I'm dying here. I cannot remember your name, but as soon as I get home, I can tell my husband, and she was here, and she, right? And so that pressure, I don't have MS, but I'm sitting at the front of a room, and I suddenly have word-finding difficulties. Many of us experience that. Concentration. Jessica did a fabulous talk. I really appreciate that. For those of us who don't live with MS, that talk was a fabulous one for all of us. But that multitasking, that has been so disproven, whether you live with MS or not. A lot of us kind of prided ourselves as, I can do 3 things at the same time. Turns out but you really don't do any of them really well, all right? And so when you have MS, you may notice that it gets a little harder to pay the bills and have the TV on. Right? And so if turning down the TV, finding quieter environments. Sometimes people will say, I really don't like going out to eat anymore, because all that sound, that distraction of people around, I have a harder time concentrating. And so those are some of the examples I come up with. Are there any examples that anybody else would like to add? Has anybody noticed kind of what I'm talking about? I see a few nodding heads from people who don't have MS. Yes, ma'am.
I think I've had them all at one time or another. But I do have a question for you. Okay. In your practice, do you ever see patients who improve with MS? I mean, like significantly improve?
Oh, I hope so, or I'm going to have a very, so,
going
out of business tomorrow.
The study, the thing is about MS, everybody thinks they're just going to get worse and worse and worse. Right. And I think we can get better too.
Yes, and so when people come in, we really try to do kind of the range of what the experience of living with MS. So there's so much a focus, and certainly there should be to a certain extent, on what drug should you be on? What does your MRI look like? But I think when we're really looking at this from a more of a holistic, then we start asking about, are you exercising? Tell me a little bit about your stress management. You know, we spend a lot of time with, again, woman in the room, back in the room I've never met before. We have handouts that were developed by the woman in the back that I've never met before, that look at some of those mindfulness meditation apps. And I know every patient's had it at least once, and I probably have 20 copies at the house, because these are all things that when you're looking at. So when you say, what is it like to get better? Well, a lot of times we have to define that. And I think that's one of the things when you come into the office, and I know that's one of the points later, is to talk about what are we looking for in communication. So I tried an experiment in my office a little over a year ago. And I had, we have the traditional come in, you meet the medical assistant, she takes your blood pressure, checks what medicines you're on. And I had her ask, what is your question for today? And people were really thrown by that, right? Like, well, I'm here because you made my appointment for 3 months. But what do you want out of this? What do you need to focus on? And that can be very individual. I happen to know there's a master gardener in the room. All right. And so when she was having trouble with her gardening, well, that was one of our most important goals. All right. There's a fabulous painter in the back, right? And so we want to make sure that she's able to maintain the fine motor control so she can continue to produce the artwork that she does. There's a physical therapist that I'm very big a fan of. We talked about women we've never met at the right table over here that specialize in pelvic health. And how many of us are dealing with issues with bowel and bladder? We want to keep her in the field and active and doing what she loves doing, and we benefit from that for as long as possible. So when you go in and someone says to you, what is your question? Part of what you need to decide is, what do I need to be working on? The soap fairy is here today. And that's a wonderful example of a woman who took a hobby and turned it into really, she's quite famous. She's not in costume today. I guess there was enough with Santa here. But she has her soap fairy business. And so, what are you trying to focus towards? And that's what we work on, is to say, there's sometimes a disconnect. I can say, your MRI looks beautiful. And you're like, well, I'm not painting like I was. All right. Well, then we go back in our teams and go, when's the last time you saw occupational therapy? When's the last time you saw physical therapy? Are there things that we can do to address that?
Anybody have a question that they want to ask? Great. And before I read this person's question, people have often asked me how it is that I'm able to get around the country doing all that I am doing. And the answer is quite simple. And it's not what you've learned about, I have MS, MS doesn't have me. But I actually trained MS to live my life. Okay? And if it doesn't like it, I always told it can blank, blank, leave. Okay? Now, you could fill in the blanks, all right? But the bottom line is, I want to get out there, I want to be able to provide. I don't have time to have MS in my life, and so I just do it. And when I do get fatigued, well, I do know it, and I just take some time out, 10 minutes, 15 minutes, and just recharge a little bit, all right? But I don't say that, this thing has knocked me out today, and I'm just giving up on the rest of the day. Yeah, there are people that have to do that, but fortunately I don't, or I just push through it, and that's it, okay?
I think a great example for that, Stuart, is that a lot of times, especially in the holiday season, people will say, well, if I travel, I'm just going to be so exhausted, so I'm not going to travel.
Right.
And talking about, well, what if you left a day early and you had a day of rest, right? Or when you travel to some exotic environment that before, we hit the ground, we're ready to go. Maybe you hit the ground and you rest for a day, all right? You let the time change. Disney is a big conversation, right? Had a lady earlier today, I don't think she's in the room, said, I'm in training for going to Disney. And any of us ever been to Disney, that makes a lot of sense, right? We got to train for that. That's a lot of energy. But it's thinking about how can we maybe adapt, how can we accommodate, and it's all common sense things, right? A lot of it's like, well, I wouldn't mind taking a day to rest beforehand. And so not saying I can't do this, but can we as a team, as your medical team, find ways to support you so that you can be successful in what you want to do?
So even when we get out there to do all these programs, I'm on the road as much as I am because we fly out the day prior. I mean, one thing is, it's less stressful knowing that, hey, if your plane flight is canceled, you have more time to get there, all right? So we live without the stress of having to be there that same day, get there the day prior, and then fortunately, if we do, then we go to a place like Reedy Falls and see how beautiful this is in the middle of Greenville, all right? But it was just something to just
Reedy Falls.
What's that? Reedy Falls? I'm sorry.
For those of us who are like, you went where?
They must have written the magazine wrong that I read. All right. Before I get to this gentleman's question, this person over here asked what you would suggest for better sleep.
So, we see on the news all the time, and in fact, it was on there again this morning, that if you don't sleep well, guess what? You're not as healthy. And the example this morning was if you don't sleep well, you're more likely to have migraines. A lot of it's our bad habits. When people say, I'm having trouble sleeping, they usually are thinking, I'm going to say, I got a pill. Right? But that's actually not where we go. And so we talk about you're turning your cell phones off. Are you watching the news at 11 o'clock at night and get your heart rate all up? Are you reading that whodunit and you can't? So some of these bad habits, I am very much against having TVs in the bedroom. All right, that's actually a horrible habit, and I know most people do. But so far, my husband does not have a TV, and well, that's way too much to share on camera. So I mean, it's like looking at some of these hobbies. So people who exercise sleep better. People who eat earlier in the evening sleep better.
And drink earlier as well.
And drink earlier in the evening sleep better. So it's looking like, what's your bedtime routine? Do you start, remember when we were kids, and most of us, mom would read us a story? Was mom really being nice, or was mom trying to settle us down so that we would have an easier time going to sleep? We still need that bedtime story. All right, it just may look a little different. So I tend to meditate at bedtime. That helps me kind of calm down. And then there are times when people get their nights and their days mixed up. And so when people are not in their normal work environments and they can kind of drowse through the day, well, you're not going to sleep at night if you've been up all day. So those are kind of and then, oh yes, there are pills, but we try to not use that as our first line. Unique to MS, Stuart, is what's keeping you up? Is it that your legs start jumping later in the evening? So is it your spasticity that's kicking you? Is it that, well, there's no reason for me to go to bed because I'm going to get up 8 times a night to go to the bathroom, so there's no hurry. So can we do a better job about managing your bladder control? I think there's a lot of things that go into the conversation about, what can we do to enhance your sleep?
Only one. One germ. This is more of just a follow-on comment with what you had said just before about the travel. And what we found is when we do a longer trip, we go ahead and break the trip and spend the night in the hotel at an intermediate location if it's a long trip. And that way, not only does it take away some of the stress of connecting flights if there's delays and that sort of thing, but it also breaks up the trip to a point where you're not so exhausted.
And that's excellent advice, and I think that's what we try. Sometimes we have our mind so set that we need to do it like we've always done it, that we almost need somebody else to say, have you thought of? Right? And a lot of these pieces of advice, like How to Survive Disney, they write books on how to survive Disney. And that's not how to survive Disney if you're living with MS. It's, boy, it takes a lot to survive Disney, but there are ways to do that so you can actually enjoy Disney.
Thank you. You guys can continue. I'll get you in the next round.
Let's talk a little bit about understanding brain health and MS relapse. And let's go into MRIs a little bit.
So MRIs have been a very popular, they're a very important tool in how we monitor how people are doing with MS.
Would you consider them a biomarker?
So people have used that term as a biomarker. And so a biomarker is not unlike someone who, for example, has diabetes, and we follow their blood sugar levels, right? The challenge with MRIs is it doesn't tell us everything we want it to tell us. And so when we're looking for lesions or new white spots or whether they light up, one of the things that's humbled us is that, and I make this mistake in the office every day, and I always try to apologize, is I still tend to point to the white spots and say, that's your MS. But we know from research that's been done that that's just really a tip of the iceberg. If we look at how someone's brain that's has MS is metabolizing sugar, it's different even in areas that are nowhere near those white spots. We look at the breakdown products. And so we mentioned earlier, like when we're talking about progression in MS, it's not that I look at the MRI and go, oh, I see you are progressing. It may show me evidence of more relapses, but a lot of times when people start talking about this change in their level of function, the MRI goes quiet. So it's very helpful, but it's not the whole story. And patients have been telling us that for a long time. You know, doctors take a little longer. But we certainly are now recognizing that disconnect between the two. That said, it's a very important thing to do, all right? And so when we're talking about our treatments, we don't want to see your MRI changing. If your MRI is changing, we need to look at our options and see is there something else we can be doing different.
Is it possible to identify a particular symptom or set of symptoms from where your lesions appear to be?
So what the challenge is people point to a spot and say, what does that do? And then they think, I really don't know neurology, because I go, well, I don't know. So the difference between MS and a stroke is that in a stroke, the tissue's dead. And I'm really good at telling you what you look like when part of your brain is just not working at all. The difference with MS is that when I see changes on your MRI, I can just tell you that something happened there. I can't tell you if the information is traveling through 10% slower or 95% slower. I can't tell you if that's bad inflammation where it's trying to destroy the myelin around the nerves, or if it's good inflammation where your body's trying to heal the damage. So I do a lot of stuttering when people show me things. I can do the basics. If you're weak on the left side of your body, if there's anything on the right side of your brain, I can give a pretty good guess. But otherwise, I tend to kind of get a little stuttery when people say, well, show me where is the one that's causing this symptom, because it's not that specific.
Is it specific in terms of brain lesions versus spinal cord lesions?
Well, I can look at what part of the brain I can talk about. This is part of the brain typically does this. So, I know the right side of the brain controls the left side of the body. If you're having trouble with balance, I look at your cerebellum, or I look at where the connections are between the cerebellum and your inner ears. So I can get in that range. The spinal cord's not very forgiving. Right? And it's amazing that, the spinal cord is actually about the size of your pinky. And so if you put one little spot into something the size of your pinky, well, you're going to know about that lesion. And all that information has to get through to your arms and legs. It's got to get through something pretty small. So I actually look much better when you ask me, what are my symptoms coming from a spinal cord lesion? So I think that's, have you heard of the bathtub? Have y'all talked bathtubs in this MS? So in a way to try to correlate what kind of symptoms people have, we've used the term like there are some high rent districts, right? If you have something in your spinal cord, you're likely to know about it. Because sometimes people say, why do you need to do an MRI? I haven't noticed anything. And we talk about large parts of the brain are essentially clinically silent. No one's ever called me and said, I lost 10% of my creativity last night. Right? I mean, that doesn't happen. People notice if they've lost the strength in the arm. And so Steve Krieger, who I'm a huge fan of, used the bathtub or a pool, and he had kind of the shallow end of the pool where if you had a change, you were much more likely to notice that. So if you had a change that affected your walking or spinal cord, if you had a change that affected your vision, optic neuritis, then you're much more likely to see that. The other part, the deep end of the pool, is things like creativity, concentration, all those things that we know that the brain is very much involved with, but we can't pick that out on a routine neuro exam. And so that's a nice way. So what you hear is we've really struggled with this conversation around, can I look at an MRI and tell you what you look like? This is the reason why I still have to come to work. Because I can't just say, send me your MRI and I'll call you and tell you how you're doing. The dream is to, work from the house, but not yet. Technology's not quite yet there.
Does anybody have any questions or thoughts about MRI?
Does anybody have any questions about MRI? If not, I have a question that somebody gave me about something else. And no, I'm not holding a knife for any other reason. This person would like to know, is mental health problems complicating MS issues such as depression and anxiety? And going further, can antidepressant meds help? And would this help have serious side effects? Or could it just cause more complications?
So we can answer this question that that certainly there are mental health issues are not uncommon. Right? And we talk about depression and anxiety. There's some statistics that women will have at least one episode of a major depression in their lifetime, usually caused by men. I'm not sure if that's scientific. I threw that in there.
I think you're right.
But yeah, you don't have to prove that, do you? So 80% of women will have at least one episode, right? And so is that in reaction to something that's happened to their life? Or is that a reaction to a change that happened with the brain itself? There's a specific stroke syndrome that we know if people have this stroke in this area, there's a very high chance, almost like we just expect it, that they're going to get very depressed. So we look at the MRI and we said, oh, they had a stroke there. They're going to get depressed. We go ahead and start treating it. So we know that there's a part of the brain that's actually involved with mood, right? We know that when we talk about anxiety and depression that we can measure neurotransmitters. We've gotten away from the, oh, just pull up your boots and get over it, right? We know that these are medical illnesses. And so they need to be treated just like they need to be treated in any other symptom. Is it the MS? Is it you get to do real people things too, right? You don't get a free pass. I have MS. I will never get diabetes. I have MS. I don't have to worry about my blood pressure. You still get the likelihood. You get the same joy as the rest of us do. You just get a little extra, okay? And so it's important to identify it mainly because it is such a major impact on quality of life. All right. And so we do want to treat that. We want to treat that with supportive counseling. All right. The study after study of study has showed that if you just talk about, sometimes people just want a pill, right? Just give me a pill and fix this. And certainly pharmaceuticals can be very important. All right. Exercise can be very important. Are you sleeping well can be very important. Are you in pain? You know, pain certainly will take the mood off, all right? So there are other things contributing to it. And are you in counseling? All right. I personally, and I'll go on camera saying this, is I'm not really sure why you need a dentist after a certain year, okay? I mean, I started brushing my teeth somewhere around 3rd grade really religiously. And I do now. Twice a day, I brush my teeth. If my tooth hurts, I'm going to call a dentist, all right? But I pay for them to come in and look in and say, no, it looks okay. But what about counseling? Every day I could use a counselor. All right, I got a 19-year-old. I could probably use one twice a day. All right, and so how many times do we need to check in for just our mental health? To have that person where we can say, here's what my challenge of the day is. All right, and there are times when all of our lives, whether you're living with MS or not, that you need to address that more aggressively than others. All right, I kind of think I need my counselor on standby, and there are days when, like, the holidays are coming, and we all know the holidays are wonderful, and they're also challenging, which is why I was taking notes during Jessica. I was like, nah, I'm going to say no more, like 1 dozen cookies versus 10 dozen cookies. I make no cookies. So that was an example that just went right by me. My family's not worried about me cutting back on cookies. I'm eating them, but not the other. So the other side of the coin is people are sometimes worried. I don't want to be on a lot of medications. Well, I agree with you. You just need to be on the medications that you need. And that over time, that just because we're having to treat depression or anxiety right now doesn't necessarily mean that it needs to be a long-term intervention. And that we may be able to, over time, pull it back. But I don't walk up to diabetics and go, listen, have you tried to cut your insulin? Because, you know, I don't know if you're still a diabetic. Right? And so I always want to make sure we're clear on that depression and anxiety is a medical illness. And just like we wouldn't walk up to somebody with high blood pressure and go like, listen, have you just tried exercising? Okay, surely. We want you to exercise. We want you to try to lose those extra pounds. But we never really say to folks, just get over your high blood pressure, okay? And we know that there's an approach that we need to really go after. I think you hit one of my soapboxes. I'm sorry about that, but I think that's an important one.
So are you saying that once you have depression, you think you're more prone to more serious depression?
So there are, so let me use,
like a round thing,
so
you know,
let me
round
just,
1, round
let me
2.
use a different example, all right? So let's just talk high blood pressure. You meet people who say, I had high blood pressure and I just cut all the salt out of my diet and my blood pressure is fine, right? Then you meet another person who says, I have high blood pressure, and I cut the salt. I took 3 different meds. I lost 50 pounds. I exercise, and now my kidneys are going because we can't manage my high blood pressure. It's a spectrum. And people live at all parts of that spectrum, all right? And so I don't know that I can predict just saying if you have depression, you're more likely to get depressed again. Depends on how many husbands you have, you know, how many kids you have. I mean, there's lots of things. They're not really taping this, are you, Stuart? But there's a lot of things that contribute to that.
I'm only pretending just to get you to ask these things. We have a question over here.
Well, actually, I just had a comment on what you were talking about. With the medications, a lot of them can make you more fatigued. So if you have time to sit at home for weeks and get used to the medication, probably 4 to 6 weeks, and can get through those side effects, it could possibly work. But you have to watch out sometimes because that could be a sign of a relapse for me. I know some people have had the crying, depression with even suicidal ideations. And that can actually be a sign of a relapse for me. I possibly may need medication adjustment. It's a sign I could be going into a relapse. So I do know that a lot of them can make you very fatigued, and I get that. And sometimes that's not worth the side effects. So.
Well, and I know that's always one of the concerns. And I want to say I wasn't smiling at your response, but there was a really cute baby. For the camera, there was a really cute baby that was going across, and you can't help but smile at a really cute baby. So, yes, all of our medicines. Now, there's a gentleman laughing. I'm not sure what he's laughing at. The baby wasn't cute? I thought it was cute. Don't say that out loud, because, Grandma's right behind you. There's an art to using a lot of medications. And every medicine has a risk and a benefit, right? And you're absolutely right. We never want to put somebody on a medicine that has more side effects than the benefit. But there are some people who just tend to be a little bit more sensitive. I like to term that you are a cheap date, right? There are some people who will lick a pill, and that's all they need. And there's people that say, I took 10 and I didn't notice anything. I'm not recommending going home and taking 10 of anything, all right, never take 10 of anything, I think. I can't think of an example of that one. But part of that is if we recognize that you are somebody who's more sensitive to medications, do we start the doses at a lower dose? Do we increase the doses slower? All right. But I always try to encourage people to say, if we can get through having you, we have an eye on the prize. It depends on what you're looking. Spasticity really has a lot of problems. All right, it's painful. It interrupts people's sleep. It affects their gait. Unfortunately, the medicines we use for spasticity, well, they can make you drowsy and they can make you a little foggy thinking. And no one's ever said to me, well, as long as I walk pretty, I don't care if I can't remember where I'm going. And so we have to kind of do that strategically, and maybe start at lower doses, all right? And I also recognize, and I think that's part of that communication with your healthcare provider, is that there are times when you can say, okay, I'm going to be home for the next 4 to 6 weeks. I can't do that. But maybe you start a new medicine on Friday. So if you have, if you're a little bit drowsy on Saturday and Sunday, hopefully you can plan to sleep in. It's important to know what's going on in your life. If you're about to make a major trip, 4 hours time change, you go, well, maybe now's not to start a new meds. But I think that's part of the conversation about what's your concern, what's your previous experience, and then saying, is there another way we can approach this conversation? All right.
Okay, next topic.
Can we move on to healthcare team, which you were just talking about? What are your thoughts about people going into a visit with areas of concern that they want to talk about?
Well, I think that's really, if you get to the end of the visit and you walk out and she said, well, she never read my mind, you're probably right, okay? And most healthcare providers aren't really good at reading your mind. And so now we're also not so good at pausing and saying, is there anything you want to talk about, right? I'll admit, when I was in med school, just a few years ago, we weren't trained to say, and what would you like? Now, I will tell you, with new medical school training, we spend a lot of time saying, how do we get patients to talk to us and that. So that's going to catch up eventually. But the other is, there's nothing wrong with writing down what you want to talk about. I love it when patients pull out their cell phone and say, let me check and make sure. Now, if you came in with 50 questions, we may need to answer some of those next visit, okay? That's not really fair. I've been in there, we've been talking, and you go, let me go over my 50 questions that I'd like to ask. But I do think before you go into the doctor's office, you need to start saying from the very beginning, today I want to discuss this. Because we have so many things we need to discuss, right? I have my own agenda. I want to know if you're taking your meds. I want to know if you're having any side effects. Sometimes I have lab work monitoring that I need to make sure you've had done and look at the results. I may need to look at an MRI, right? There's lots of things that I have on my agenda when I see Ms. X come in and I go, okay, here's what I need to cover. But also being prepared and having no problems with saying, before you leave the room, do you mind if let me check to see if I got all my questions answered. Right.
And do you have an approach for getting people to talk about some of those sensitive subjects?
I do.
Can you share that?
Well, I have I may have a little atypical bedside manner. But I try to use humor, but I also try to coach it. So if I know somebody has changes in their spinal cord, I know that there's a pretty good chance that they have problems with their bladder. And I know that if you have problems with your bladder, well, those nerves go to other sensitive parts of the body, and you may have problems in those areas. I may not bring it up the first time we meet because, that's a little hard. But I tend to walk around and, try to bring that up in conversation. So for those of you like, what is she walking around? Sexual dysfunction. We'll say it really quick. It's a PG movie. But I already know this. You're not going to surprise me. I'm not going to go like, wow, that happened to you? I've never heard of that before, right? And so, but I do sometimes say, we just met. Maybe I'll just kind of say some of the things that we might want to talk about or this, and open the door. Sometimes people come right through, sometimes people don't. A common one is, a lot of people with MS try various supplements, and I'd like to know about all the supplements that you're trying. And it's usually not the first visit. But after they get to know me a little bit, it's amazing how many people have tried a little THC in various forms. And sometimes I just want to ask, where'd you find it? We're in South Carolina, all right? So I got to ask, are you on a street corner? So where are you getting it from? But opening that door, and that's part of a relationship. And I think that if you can build that relationship, then you can open that door. We're not really walking up to strangers and going, so I just wanted you to know I've got some bladder control issues, and as you know, when I have bladder control issues and I have some other issues, we don't have those conversations. But trying to kind of open that door and leave a little time to say, I was just thinking. No, you've never mentioned it, but there are some people who have problems in these areas. And that's actually one of the reasons why many of the physicians are such fans of Stewart. I mean, we had to find a reason. No, but there were, because these live programs allow us. Did you hear me? Do I need to say it again?
What'd you say?
No.
I want to hear you say it again.
I would like to get invited back again.
I dare you. Say it again.
So 71 live programs. The opportunity to talk to people next to you, to hear other people's questions. There will be some people in the room who'll never speak tonight, but will go home and say, right? That's why we do these programs. And I think it's fabulous that we can still maintain that. And we can open up some of these conversations. And maybe next time you're in the office, you say, well, as you know, I have some bladder problems. And as you already know, right? And so open up some of those doors, okay? And say, well, am I just a little moody or am I depressed, right? It's okay to have those conversations. And sometimes you just have to open those doors a little bit.
You talked already a little bit about exercise and healthy living. Can you just repeat again how you think that fits into a good lifestyle for people?
So I am not aware of any disease in which we've proven that exercise is bad. Nor am I aware of any disease in which we've said good healthy diets is bad. I wish we'd find one because I'd like to have that one. But over and over, we know the benefits of exercise. And the history of people living with MS actually originally
wasn't always that way.
No, we were wrong. We told people, well, gosh, you shouldn't exercise, go sit down. And when you do that, when you stop moving around, when you start exercising, has anybody been in the bed for a week with the flu? And then you get back up and you're like, I'm kind of weak all over, right? And so that's that same kind of message, is that we all need to be exercising. Now, does that mean all of us are doing jazzercise? No. One of our goals is to find an exercise regimen that works for you. And whether that's, working with physical therapy, there are some people who exercise all the time, and there's some people who start, well, I pretty much will join a gym on January 1st, and you usually have to pay for 3 months. So I've got a good membership of January, February, March. So I'm not the poster child for this. But I know that when I'm exercising, I feel better. And that's one of the things that we have to identify. What is it you enjoy doing? If you're afraid of the water, I don't say, well, you need to swim. All right? So we need to find something that you can incorporate in your lifestyle and that you can do and enjoy on a regular basis. Exercising with friends. None of my friends exercise. No, I'm just kidding. But, you know, doing group exercise, so someone says, oh, I didn't see you last week. Well, that'll get you the next week, right? So trying to kind of build that into your life is important. It doesn't matter if you're living with MS or not.
So you're talking a little bit about accountability there.
Oh, I'm talking about a lot of accountability. When we talked about, well, I don't know if we talked about it, but Jessica touched on it, is it's a partnership when you come in. All right. If you come in and just say, do what you want to do with me, you know, whatever pill you want to give me, and then you don't do your part, you don't exercise, you don't eat right, you don't communicate, I can tell you right now, the outcomes aren't good. All right. And the reason why there's such a focus on because I really want to look good, right? I want my patients to look the best. And I think over time, you know, we see this now. We see an 88-year-old woman walking by and you're like, she's what, right? I want to be her. And it turns out she probably ate well, and she probably didn't smoke, and now, you know, there's always the 99-year-olds that I did all those things. But there aren't a whole lot of 99-year-olds who did that. So, like, what are the changes we can make early to really help us stay healthy a long time?
What kinds of things?
I'm
sorry.
Oh, I'm sorry.
No, go ahead.
I just wanted to say on the point of exercise, I mean, every time you reach out in front of you to grab that drink on the counter or wherever, you've just done an exercise. So if you do that 20 times, oh my gosh, you've just done 20 reps.
Does it matter what you're drinking?
No, you can drink whatever you want for this example, but doing these things intermittently instead of trying to do one pump,
right,
and pump them all out.
That's really important. And so I think, so it's been shown that if you do 5 minutes of exercise 3 times a day, it's the same as if you did 15 minutes in a row. All right. And so when people who have not been exercising, including myself, restart, because we'll restart in January, you know, if I can only do 3 minutes on the treadmill, that's fabulous. I just need to come back and do 3 more minutes, all right, and gradually work up to that. And so that's really about having kind of appropriate expectations and working yourself back into it. A few years ago, I had a patient that belonged to the same gym I did, and he would get there 30 minutes after I did. And that was a problem because about 30 minutes on the treadmill, I was about falling off, but I'd see him coming, and I can't get off the treadmill, right? So and he'd be standing there trying to talk to me, and I can't talk and walk. And so, you know, but that, you know, that is where I hope to get back to. But you may start out at 2 minutes, 5 minutes, multiple times a day. We've got to meet you where you are and build you up, all right? That's a very good point.
How about all the people that say they can't do a squat, but every time they sit in a chair, they're doing a squat? I know you were thinking something else, right?
I try not to think when I'm around you.
Right.
That's a sit to stand, by the way.
Yeah.
What's that?
That's a sit to stand.
Sit to stand. Well, you got to sit and you got to stand.
Right.
Well, that's a squat and a stand. Mm-hmm. And then if you go to the toilet, you got to squat too, right?
Have you served dessert yet? No.
That's PGR.
PGR.
Yeah.
So your next topic was?
Okay. Let's talk about managing MS today and finding out then about how people here tend to manage their MS.
I think it's a great idea. And so I know there are hints that people, because I've incorporated a lot of your suggestions in how to exercise, how to eat well, but what are some of the hints if you had to say to somebody else, people I've never met before at the table to the right? You know, what would you've got some great advice of people, what would you suggest? Sure, start here. So what's a hint for others that are in the room to say, you know, something that's really worked well for me that I've incorporated, whether that's something as a care partner or a family member, or whether that's the person who's actually living with the MS?
I walk a lot, and I get into, as you said before, gardening, and try to do as much as I possibly can.
Yes, I'm a mother of children, so they keep me active as well. So I'm always running around with them, so it tends to help me as well. Exercising.
And she makes choices, woman I've never met before. Because, you know, so I'm a mom too, but getting your child back and forth to karate. You make choices in life, all right? And so do you sit while your son's playing baseball, or do you walk the field, right? I mean, there's lots of opportunities to stay active and really, she's got some fabulous children. I just happen to know that.
Can we get another table involved?
Why, sure.
Please. I need you to ask them.
Table to the left, people I've never met before. So I think I will ask the soap fairy. I'm sorry, you're just going to have to be famous. I know her story, and I'm a huge fan of her art. And so, but what would be one of your hints?
I will come back to what you just told me recently. I've experienced a lot of pain in the early fall and into the winter, and almost decided to give up on the soap fairies and building my business. And you told me something that has really resonated with me, that, well, it doesn't have to be forever. This is just a season. It's just right now. Don't give up.
I always get nervous when people say, let me tell you what you said to me. I'm like, what kind of day was I having? Oh, that sounds like a good one. I'm glad I did.
That's a very good one.
She's been wonderful for me for years now, and thank you.
Yeah.
Thank you very much for being my wonderful neurologist.
Well, I appreciate that, and your Christmas cards in the mail. But I think, you know, what I remember. Well, no checks. I'm a neurologist. There's no checks going out. We need more to come in. But I think taking that's a hobby, and so she does these wonderful body balms and lotions and mosquito, you know, and really very natural. And taking something that's really been something she's really been focused in. How can she help others, right? And then turning that into a business, and then the times we have to step back. It's you know, this is the woman who said, instead of 10 dozen cookies, I just do one, right? I'm like, I don't do any.
Anybody else have any particular thoughts about managing their MS?
One moment. Shoeless Jackson.
What happened? I'm not even asking. That advice came in to knock his shoes off. Sometimes, can I make a point? Sometimes you have to ask for help. So, a woman I've never met before on the left, work said no. So some very reasonable accommodations, right? And so we were like, I don't think that's legal, and I think those are not reasonable. You know, it's not reasonable to say, no, you can't have water at your workstation, and it's not reasonable to say you have to stand up in that particular environment. And so being, you know, hopefully that if you identify barriers, that you can use your healthcare team to help support that, all right? And that's another way of saying sometimes you have to, like, ask for help with that. You know, a nasty letter from your neurologist, well, didn't go very far, but sometimes it does. Sometimes it does.
For me, I'm a patient of Dr. Hughes, and she's the third neurologist I've used in Greenville, so it was just finding a good fit for me. And our first experience in your office was probably the best overview of my history and our plan and everything that I've received. Thank you.
I got a lot of Christmas cards to write. Thank you. I appreciate that. I really
Thank
do.
you cards, more
Well,
better said, right?
So I would say for me, staying mobile throughout the day really helps me out. If I take 5 minutes every hour just to get up from my desk and try to walk around for like another 5 minutes just to get some steps in, then I feel so much better than if I'm sitting in a cubicle for 4 hours straight. So.
Thank you. How many of you all get to Atlanta Airport every week?
You do.
That's walking.
That's why I'm walking shoeless.
Well, we're also the home of Shoeless Jackson, so if you go downtown, you can find a statue.
Shoeless Joe.
Actually.
Oh, okay. All right.
The last thing I wanted to talk with you about is comprehensive MS centers. And do you think they're a benefit? Do you think they're... Let me ask this. If you're not able to find one, which I cannot find a center like that in my area, what is the next alternative?
So first, what is a comprehensive MS center? So the National MS Society has a designation for what they officially will certify as a comprehensive MS center. And that means that what they've looked at is the healthcare team, and they put it all under the same roof. And that is nice, but we don't really have that here in South Carolina. But does that mean that we don't have a healthcare team? No, that doesn't mean that, all right? And so looking for, I think one of the reasons why this is so important, these programs are so important, is the better educated you are, the better advocate you can be for yourself, all right? And if your neurologist says, no, I don't think you need to go to physical therapy, you need another neurologist, right? I had a patient recently said, she needed to change her MS drug, and she said he wanted a few months because he was going to go to a meeting and he'd come back and tell her what he thought. And I went, you might want somebody who's a little bit more familiar with I appreciate he was willing to go read, but I didn't know if that made me confident. So there are people who have spent more time with people living with MS that are engaged with their healthcare teams. So whether that's PT, OT, your pelvic floor specialist, your social worker, and then they don't all have to be under the same roof, but they need to be part of your team, right? And having access to that. And those are things you can advocate for. It's really speaking to that when we're caring for people with MS, we need to be approaching them from a very comprehensive standpoint, all right? And that's a change in how we've approached MS. I love the example of, and we haven't had dessert yet, but I always say if you have toe fungus, you really don't need a full team. You might need a dermatologist. But you probably don't need PT and OT, you don't need speech, and may you never need those. But hopefully your neurologist has identified those people in the community in the event that you do need them, all right? And that's really where that comprehensive care is.
Who is the leader of the healthcare team if they're not all centralized?
And the last time I checked was the patient, right? And so we want to build that team around the person who's in the center. Every single patient I've ever had knows that, what's the phrase? I'm not a real doctor. And so you need a real doctor, and never leave out your primary care physician, all right? And you need a very good primary care physician. And so I'm always really cautious when people identify a specialist as being the leader, because, there's so much more to you than your MS. So I would say the patient's at the center. The primary care physician is really the one that's in charge of 98% of your health care, right? Because I'm never going to really, I don't really check your hemoglobin A1C. And I see on TV, just like you do, the commercials for diabetes, and I'm like, that looks like a new drug. But you don't really mean picking. Do you want the one in the purple shirt or the blue shirt? You want somebody who knows what they're doing and has experience with that. And then I think you're talking about what role does the neurologist, and there are different parts of your healthcare team that you may need at different times, all right? Some people need a physical therapist right now. Some people, no, not really, all right? If you're running a marathon, you probably don't need a physical therapist. But you may be going through some changes in life, and maybe your counselor is a more important part of the healthcare team. And so we want to identify all those people that are available. I think that's the concept behind the comprehensive center, is that we've spent the time of thinking through and making these relationships with other providers in our community. So we don't go, well, let's go look in a phone book. But also that is so individualized. If we went around the room and asked everybody in their room, what was your experience of getting diagnosed or living with MS, what you're going to find, it's very individualized for each one of you. So it's not cookie cutter. I am so upset about those cookies. It is not cookie cutter, all right? I can't have the same plan for everybody, all right?
And what if your physicians don't talk to each other?
Well, not what if. We don't.
Okay, so what does the patient do?
The reality is that's a big problem. Our medical records don't speak to each other. I can tell you, I push the fax button, but then the doctor, I don't know. What if you're out of paper at the other end? So we do try it, and there's a lot of interest in focusing on how can we make that better, right? But between now and then, the person at the center is the person living with MS. And so knowing where you had a particular test done, knowing that you had a particular test done. A patient recently for his primary care physician ordered MRI. And I was like, well, I didn't know about it, but I'd sure like to see it. And so we had to track it down. who was the person at the middle who told me about it and helped me identify where to go calling this? Well, that was the person living with MS, all right? And so is that the ideal? No. All right, I know it's not. Is that what we face every day? Yes. All right. And so keeping up with, if there's a gift that your physicians would like, it would be a list of all the doctors that you see. It's a list of all the medications you are on. It's a list of your pharmacies, because you may have more than one pharmacy depending on your different drugs. All that becomes very important, not just for your neurologist, but to take it to your primary care physician. All right, and that if there's key parts of your health care that needs to know. I'm not a real doctor, but I sure kind of like to know if you're having problems with your heart. All right, I'm not a real doctor, but if you're diabetic, I'm not the one treating it, but I kind of keep an eye over, okay? And so making sure that we are really informed of all aspects of your health care. That list is what I wish for Christmas, because that helps me do such a better job of keeping up with you. And if I don't have something, I call and go, oh, I need to call Dr. Brown to see if you had labs done. And I need to make sure Dr. Brown knows.
So you're talking about the patient being their own advocate.
Until there's a better plan that works 100% of the time, that is your role, all right? And whether it's the patient or your care partner, all right? Some of you know I had an illness recently. My husband was fabulous. Oh gosh, I'm on camera complimenting the man. But he was fabulous. And I had a hard time hearing everything because there was a lot coming to me and I was emotional. And he would hear that piece that I forgot, or he'd kind of prod me and say, weren't you going to ask? Now the man said he had to go home with me, so he wanted me to get everything I need to know there, so he didn't have to hear it in the car on the way home, I'm sure. But it was very helpful for me to have him with me. And he'd kind of go like, I don't know anything about medicine. I'm like, yeah, but you're a real human being who cares. And that's what I need at my side, all right? And so if you don't feel like you're in a position to be able to remember everything, or you get home and you have a list of things that you didn't get a chance to talk about, ask a friend, all right? Ask a friend, ask a loved one to come with you to your appointments to kind of help advocate for that. We work as a team, all right? I'm a very blessed woman, and I can say, well, we need the following results. And then I walk out my office and go, we need the following results. All right? We all need to work together as a team to really try to help bring that together.
Great.
Well, thank you very much for doing this, both of you. That was awesome, right? Thank you. So if anybody has any questions in general now that you would like to hit up Dr. Hughes with, now is the time, but just raise your hand. Let me get to you with a microphone and then ask away. Anybody? Wow, you're all educated. Well, that's great. So number one thing that I want to ask you all is, did you have a good time tonight? Yes. Great. Dr. Hughes, thank you very much for doing this the week before Christmas. I know that you were very much against doing this. Jill, I want to thank you. This was her first time ever doing something like this, so we want to thank you as well. And this is our last program of the year, and I could just say thank you very much.
And y'all, could you join me in saying thank you to Stuart? Because yes, Columbia is 90 miles away, and it's just around the corner, but we really appreciate that you were able to come to this community.
That's why we're here.
So thank you
That's why we're here.
And we really appreciate you coming to us.